Why does a nurse wear personal protective equipment when bed nursing a patient? Option A, to protect themselves and the patient from transferring of infection. Option B, to prevent their hand from dryness and damage. Option C, to be able to save money as the PPE can be reused. Option D, to save having to wash their uniform after the shift. Answer is A. The personal protective equipment is used to protect themselves and the patient from the transferring of infection. In respect of RIDDOR legislation, what are the correct actions for a nurse to take when a colleague suffered an accident at work resulting in a fracture of the radius? Option A. Record but do not report the accident. Option B. Record the accident in the staff message book. Option C. Record the accident to the doctor on site. Option D. Report the accident. The answer is D. If your colleague suffer with an accident at work and that result in the fracture or an injury, you have to report the accident to your line manager. Correct hand washing when dealing with the patient is a way to option A. Keep your hands soft. Option B. Avoid being told off by that ward manager. Option C. Pass time. Option D. Prevent ill health. Correct answer is D. Prevent ill health. A nurse has asked to calculate the body mass index of a patient by the doctor for medication dosage purposes. The patient does not want their height measured. What action does the nurse take? Option A. Inform the rest of the team that the patient is refusing care. Option B. Insist the patient stand up and be measured. Option C. Inform the doctor that the patient declined and await further instruction. Option D. Give an appropriate height of the patient as the doctor needs information. Answer is C. If the patient refuses to measure the height, you have to inform the doctor that the patient has declined to measure the height and await for the further instruction. Standard precautions for infection control include option A. Hand hygiene, the safe use and disposal of swab, isolation procedure. Option B. Hand hygiene, the use of personal protective equipment and sterilized knife and forks. Option C. Hand hygiene, the use of personal protective equipment and safe use and disposal of swab. Option D. The use of personal protective equipment, safe use and disposal of swab and correct laundry procedure. So the answer is C. Hand hygiene, the use of personal protective equipment and the safe use and disposal of swab. A nurse who is working in an outpatient observed that a lot of similar information is given to the patient verbally on a daily basis. How can this be minimized? Option A. Raise the finding at team meeting. Option B. Encourage the nursing staff to make notes on their conversation for the patient to take home so patient remember the information. Option C. Develop a leaflet or handout which can be used to a discussion and is something for the patient to take home. Option D. Give the patient some paper so that they can make note to help them remember the information. Answer is C. So if you're going to give lots of information to the patient together and by verbally, they are going to forget the information and that might not help the patient to improve their health. So it's better to develop a leaflet or handout which can be used to the discussion and the patient will have something to take the home. Which fluid should not be given subcutaneously? Option A. Dextrose saline. Option B. Normal saline and potassium. Option C. Normal saline. Option D. 5% dextrose. Answer is B. Normal saline and potassium should not be given subcutaneously. Which of the following parliamentary act brought in the first legal duties regarding health inequality? Option A. The Health and Social Care Act 2012. Option B. Care Act 2014. Option C. Safeguarding Act 2006. Option D. The Social Value Act 2012. The answer is A. Health and Social Care Act 2012. A person who is displaying a sign of stress, anxiety and sleeplessness can be encouraged to seek help from where? Option A. Emergency Department. Option B. 111 service. Option C. A walk-in center. Option D. General practitioner. Answer is D. If the patient have some sign and symptom that is not related to the emergency condition, they have to contact first to the general practitioner. Where is chemotherapy and hormone medication disposed of? Option A. Purple lidded sharp container or bag. Option B. Yellow sharp container or bags. Option C. Recycling waste. Option D. Black bag waste. Answer is A. Purple lidded sharp container or bags. A nurse has inserted a nasogastric tube. Which of the following can help to establish if it is in the correct place? Option A. Send for a CT scan to establish position. Option B. If patient saw no sign of respiratory distress, it can be assumed it is in the stomach. Option C. Take a sample from the stomach contents by aspirating and test the pH. Option D. Inject 10 ml of saline and monitor for respiratory distress. Answer is C. To check the nasogastric tube correct placement, you have to take a sample from the stomach content by aspirating and test the pH in a pH strip. If the pH is less than 5.5, it means that the nasogastric tube is in correct place, and you have to do this test prior to each feeding. When communicating with the patient, what are the non-verbal clues? Option A. Body language, voice tone, distance. Option B. Tone of voice, eye contact, touch. Option C. Tone of voice, distance, eye contact. Option D. Body language, eye contact, distance. Answer is D. Body language, eye contact and distance. What essential action does a nurse take to reduce the risk of infection when caring for a patient with a urinary catheter? Option A. Use soap and water to wash the catheter side. Option B. Sterilize the area daily. Option C. Educate the patient and family on catheter care. Option D. Keep the area dry. Answer is C. If you educate the patient and family on the catheter care, that will reduce the risk of urinary tract infection in the patient with the urinary catheter. Patient is bed bound and asked to see the world information booklet. It is on a table they cannot reach. How does a nurse respond? Option A. Tell the patient the booklet is boring. Option B. Ask the patient why they need to see the booklet. Option C. Move the table to the bed. Option D. Ask the patient to wait as they are busy. Answer is C. Move the table to the bed in the reach of the patient so that the patient can get the book. Minute nurse is supporting a woman with a 6-month-old baby. They notice that the baby does not respond to their name. What may this indicate? Option A. The baby is distracted. Option B. The baby may have hearing loss. Option C. The baby has lack of attachment. Option D. The baby needs feeding. Answer is B. The baby may have a hearing loss. Transformation leadership style focuses on team building, motivation, and option A. Collaboration. Option B. Collusion. Option C. Opposition. Option D. Resistance. Answer is A. Transformation leadership is a type of leadership where a leader works with a team or follower. Leaders encourage, motivate, and inspire employees to innovate and create changes that will help to grow and shape the future success of the organization. So the answer is A. Collaboration. What does a nurse observe when assessing the respiration of a patient with breathing difficulties? Option A. Presence of symmetrical movement of both sides of chest and equal breath sound. Option B. Ease of breathing, rate, pattern and evidence of cyanosis. Option C. Ability to speak in a full sentence, ease of breathing, rate, pattern, evidence of cyanosis. Option D. Rate, pattern and evidence of cyanosis. Answer is C. So when we are assessing a respiration of a patient with the breathing difficulty, you have to see the ability to speak in a full sentence of a patient and ease of breathing or regular breathing of the patient, the rate and pattern of breathing, and the evidence of cyanosis, whether the patient is having any cyanosis or not. A nurse is supervising a nursing student who is administering medication to a patient in a stroke unit. The student does not check the wristband of a patient before giving them their medication. How does the nurse respond? Option A. Tell them to stop what they are doing and report them to the manager. Option B. Say nothing as they will eventually learn the correct procedure. Option C. Take over the administration of medication and tell them later why they were at fault. Option D. Ask them to stop, quietly explain what they missed and allow them to continue under supervision. Answer is D. Ask them to stop, quietly explain what they missed and allow them to continue under supervision. Why is an intravenous route used for the administration of medication? Option A. The intravenous route provides an immediate therapeutic effect and gives better control of the rate of administration as a more precise dose can be calculated. Option B. The intravenous route reduces the risk of infection because the drugs are made in a sterile environment and are kept in aseptic conditions. Option C. It is cost effective for a patient because there is less waste as they may forget to take oral medications. Option D. It is an useful route for patients who refuse to take tablets because they do not wish to comply with treatment. The correct answer is A. The intravenous route provides an immediate therapeutic effect and gives better control of the rate of administration as more precise dose can be calculated. How senior nurse manages a potential risks to patient safety when staffing level are compromised? Option A. Monitor how well the staff cope with the workload by visiting the ward. Option B. Explain to the staff on shift that they must continue to work regardlessly. Option C. Active without delay if they believe that there is a risk to patient safety or public protection. Option D. Arrange for sandwiches to be delivered for staff to eat during the shift. Correct answer is C. Active without delay if they believe that there is a risk to patient safety or public protection. When do we need to document? Option A. As soon as possible after an event has happened to provide current up-to-date information about the care and the condition of the patient or client. Option B. Every hour. Option C. When there is a significant changes to the patient condition. Option D. At the end of the shift. Correct answer is A. As soon as possible after an event has happened to provide current up-to-date information about the care and condition of the patient or client. Thank you for watching. Please like my video and please subscribe to my channel and press the bell icon to get more video. Please keep watching and keep supporting. Thank you.